好，我们讲座即将开始了，我们大家调试一下同传设备，按照刚才那个我们说的方式连接好，把它打开，然后来调试一下。必须耳机连在这个设备上，我们才能打开，要不然的话，显示的是没有电的状态。大家核查一下自己的设备手里有没有电，然后能不能听啊？都佩戴好了之后，我们请同传老师给试验一下都好了是吧？好，我们同传老师麻烦来说几句话，我们听一下。有没有问题的？哦，这么多。有什么问题 ？Channel 就是第一个频道。哦，能听到的举手。OK。好的，都能听是吧？有问题的再举下手，听不到的。怎么了？刚才能听到吗？刚才能。来，麻烦同传老师，我们再试验一下。听到了？我其实也没动什么。好，我们大家继续是把手机关到静音状态。待会儿会带来一场知识盛宴，非常高频率、高密度的一个营养的一个传播啊，知识的传播。好，现在同传没问题的话，我们准备开始了。好，欢迎大家来到我们皇家的猫疾病专题研讨会，其实是消化道疾病的一个研讨会。看到很多熟悉的面孔，相信从上午的实操到刚才 Adam 老师给我们讲的关于猫腹泻的问题，到现在为止，很多医生对我们常见的消化道疾病是不是有了更深入的理解了呀？那么接下来老师会带来一个关于猫慢性便秘的一个讲座。那么在讲座开始前呢，我还要再次来介绍一下我们的 Adam 老师，有一些新面孔，他是来自美国俄亥俄州立大学兽医学院的内科专家，他主要研究的领域就是胃肠道疾病，还有呢胰腺炎和肝脏疾病。在他的诊所里啊，或者说他接诊的动物呢，我刚才跟他聊，其实2/3都是犬的消化道疾病，只有1/3是猫的疾病。但由于这次课程的内容安排呢，我们只带来了猫的一些慢性消化道疾病的一些介绍。明天呢，老师会。我们课程表上写的是案例分享啊，但是老师会加入一个慢性呕吐的45分钟的课程，相信很多医生也非常有兴趣来听。那么希望明天早上我还见到大家的面孔啊。好，我们现在把掌声给我们的 Adam 老师来进行第2场的讲座。大家把通传设备带好啊。
That's the last one.
Yeah.
What's this one? That's you guys.
This one. Find this. Let me see.
Here.
What is this?
Feeling constipation. This one. All right, welcome back. Thank you for the introduction. If you guys were here for the last lecture, I'm glad you stuck around for the second one that we have today. This is also an equally as exciting topic. It's a little bit less common in practice, but something that can be very frustrating on the clinical floor. So definitely something that we want to have some resources in terms of how we can best manage these cases and functionally approach them. The other thing I want you to keep in mind is some of these general definitions before we get going. Okay? So when I'm talking about constipation, constipation is defined as infrequent or difficult evacuation of feces. Okay? Whereas obstipation is intractable constipation, where what you're doing management-wise is not effective anymore, and the animal's actually becoming obstructed from severe constipation. Okay? Now that's an important difference, because most of the time on the clinic floor, what we're doing is identifying these cases more often than not. And what we don't want to do is wait till an animal is actually having colonic injury from excessive constipation in an obstipated standpoint, because there's much less I can do for that animal at that time. Currently, we have a study ongoing with constipation and looking at some treatment options, but one of the things we struggle with is identifying those early cases of constipation, because we don't actually know how frequently cats defecate. Right? So in a dog, for example, we know they defecate about 2.3 times per day on average, but we don't have that information for a cat. And then to further kind of complicate the problem, owners are often very unaware of what's actually happening in the litter box in terms of who's defecating where, whose feces are what in terms of a multi-cat household, and often aren't really aware of how many times a day a bowel movement is happening. But if you can counsel your owners to be aware of firm feces and slight decreases in the frequency of fecal passage, that can be a great time to intervene and do a lot more for your patients. So, the first thing that I think is always important is if an animal comes to you for constipation, they're going to be displaying a wide variety of clinical signs. That's because we have cats that are constipated for no apparent reason, and we have other cats that get constipated secondary to some sort of systemic disease. And as a result, how these animals manifest, what they show to their owner to make them take them to you guys in your clinic is quite variable. So what are the most common causes? Well, looking at common causes, these would be the big categories and the things that I want to hone in on when I start talking to the owner. First thing up here in the top left corner is reasons why that animal might become dehydrated or have increased water loss. Okay? Some of these are quite obvious. Hopefully you know if you put that animal on a diuretic. Right? But in other instances, it might not be quite as obvious. And you really want to either use laboratory methods like a urinalysis or clinical questioning to find out whether that animal's polyuric and polydipsic, because that's a major risk factor for constipation. You also want to hone in on your physical exam to see whether there's any obstructions that are mechanical in nature. Healed pelvic fractures are a great example. You can see benign and neoplastic rectal strictures. Colonic adenocarcinomas, a good differential for cats with obstructive constipation. And a lot of times, a combination of imaging and palpation can get you a lot of information in terms of whether those things are going on. Now, functional obstructions are related to inherent aspects of the cat's gastrointestinal physiology and motility. That's going to be much harder to document without really elaborate tests like electrophysiology. So for this one, this category often becomes a diagnosis of exclusion. I've ruled out other causes, and maybe it fits into there. On the other side of the screen, we have a lot of kind of more behavioral type issues that can cause constipation. So a lot of cats are quite particular in how they drink water. And different studies have shown that giving cats access to water that's running, giving access to fresh water, multiple locations of water, can all increase their water intake. Okay? One thing I like to ask owners about is, does the cat have any reluctance to drink? And same thing, any reluctance to defecate? Okay? Social stress in a multi-cat household often centers around the litter box. And if you have a bully cat in the house that is preventing the other cat from getting to the litter box to effectively use it, that is actually enough and has been documented to be a cause of constipation. Other things that we often don't really think of as cat problems are reasons why they wouldn't defecate because they're painful. Degenerative joint disease is an increasingly more commonly recognized disease of elderly cat population, right? And we want to make sure the animal's comfortable and can actually get to where you have the litter box. Maybe it's 2 floors down in a basement or in a different room, or maybe they have to jump up into something. Make sure the cat can do that. And then obviously certain metabolic diseases, obesity, hypothyroidism being 2 of the more commonly cited ones for constipation, can cause constipation in these cats as well. But that's obviously a large amount of differentials, right? So the other thing I focus in on is my primary concerns, okay? And when I look at this, almost 2/3 of them, when you take a whole population of cats that are constipated, are going to be idiopathic. So regardless of how much you work them up, regardless of how many diagnostics you run or what you do to look, you're not going to find anything. It's just going to be a fact that something is going on that's causing that animal to be constipated. Another roughly 20 to 25% is result of some sort of pelvic canal disorder. Okay. Now this is where we can see maybe some sort of structural issue, like a healed fracture, maybe some sort of mass, prostatic enlargement, anything along those lines that cause some sort of blockage for that cat. Now, the good news is with pelvic canal disorders, that's something with imaging and with a physical exam, you can get a pretty good idea of whether or not it's a problem. So what I'm looking for is a complete perineal reflex exam in the cat, which can be challenging, but is doable. A full conscious proprioception exam, so placement becomes very hard in cats, but you can do tactile positioning and get an idea of their hind limb neurologic function. You do want to assess anal tone, and then you want to adequately palpate very far back in the caudal abdomen, okay? Oftentimes, anything that's luminal, meaning something within the gastrointestinal tract that's causing a pelvic canal obstruction, is actually pre-pubic, meaning right in front of the pubic and palpable on an abdominal palpation. Another thing you want to make sure you're doing is palpating that animal when its bladder is empty, okay? If you have a cat bladder that's sitting there the size of like a tangerine, you're not going to be able to palpate adequately into the pelvic canal. It's going to obstruct that or block your palpation. So keep that cat in your clinic, wait till it urinates, give it access to a litter box, and then repalpate it to look one more time. Okay? But if you do that and then you image the cat with something like abdominal radiographs, you can get a pretty good idea of whether or not this is a problem. All the other causes are lumped into this last 10 to 15%, the most likely being neurologic causes, okay? But everything else, all of the other things that you saw on that previous slide, from electrolyte disorders on down to inflammatory disorders, are in that last category. Okay? So with a basic physical examination and some radiographs, you should be able to say whether or not 85% of the time or so, I'm in these 2 categories. So, similar to what we've talked about in the previous lecture with a diagnostic approach for inflammatory bowel disease and chronic enteropathies, we take a similar approach to cats with constipation with some slight differences. So in the beginning, right, I need to identify that this cat is constipated. So the owner's describing difficulty defecating, vocalization while defecating, straining in the litter box, something along those lines. Maybe they're just noticing increased fecal hardness in the litter box, or maybe they're all of a sudden just seeing urine cakes, but they're not seeing feces in the litter box. Anything like that would be an indication for further workup. once you have that constipation or obstipation in your mind, the general screening diagnostics are not that much different. Most of the time, I'm looking at general minimum database blood work. So that's going to include a complete blood count, a biochemical profile, and a urinalysis. Less commonly, I will add on a fecal examination, and I'll add on endocrine testing, specifically a T4. The reason I say less commonly is although it's reported, parasitism rarely causes constipation, and although hypothyroidism can cause constipation, unless you're talking about an animal that's been treated for hyperthyroidism, hypothyroidism is quite uncommon in cats. So if the clinical picture indicates that that might be a good idea, certainly run the fecal analysis, certainly run the T4, but if you're looking to be cost conscious with the workup, those probably aren't a great place to invest your time and energy. Your second line diagnostics are some sort of imaging. And once again, radiographs are actually probably better than ultrasound in most cases. The reason for that is you're trying to identify where the obstruction occurs, and ultrasound can't actually get through a full colon, right? All you're going to be able to see is the proximal wall. And because of that, you're going to have a really limited ability to actually see what's going on with ultrasound. So if abdominal radiographs don't give you the information you get, probably the next step up would actually be to go to something like CT, which will give you complete three-dimensional imaging. It won't give you wall layers, but it will give you wall thickness and potential masses. And then lastly, if none of this fits and you're trying to manage this cat, and you're still stuck, that's when we would actually look to say, well, maybe it is one of these uncommon inflammatory differentials or something else along the lines that we're going to require some sort of specific gastrointestinal testing. And ultimately, once again, our goal to put them into some kind of category where I can say, yes, this is what I want to manage and this is how I manage it. So that's obviously the general overview. The big question is, how do you actually apply this in the clinic? How do I realistically conduct this diagnostic evaluation? So for me, this is kind of what I do is I break it into two different categories. So first and foremost is, if this is an initial episode, it's acute onset, and it's mild in nature, I'm probably not going to do anything at all except treat it therapeutically. Okay? And that's because with acute episodes and mild changes to constipation, the likelihood of you finding something on a diagnostic workup is actually pretty uncommon. Okay? Now, if it's severe or it's chronic in nature, that's when the aggressive workup's actually much more useful and much more warranted. You are disproportionately more likely to see an abnormality or a diagnosable disease when the constipation is chronic and severe. Okay? So initial episode, I do my basic screening, but I don't go much beyond that unless the owner wants to. Chronic severe, I'm going to push them very aggressively to try to figure out exactly what's going on and how I can best manage it. So with that, that's kind of how I am going to go ahead and approach these cats. And obviously, when I talk about a more limited diagnostic approach, I don't mean to indicate you shouldn't do diagnostics. If you have a motivated owner that has the financial resources to go ahead and do that, you should do all of those diagnostics. But you should feel comfortable based on those disease prevalences in the instances where you might not have that cookie cutter perfect diagnostic workup. So regardless of whether you have kind of an acute mild case that you're just going to start treating, or you have a chronic severe case that you need to diagnostically work up and treat, you need to know the basics of actually treating those cats with constipation. So for me, these are the three big things that I'm thinking about when I start looking at my therapeutic profile. The first thing is treat and correct underlying disorders. So that gets back to the introduction to this, this talk, where if the reason that you're constipated is because of diabetes mellitus and being polyuric and polydipsic, if I'm not controlling that polyuria and polydipsia by treating your diabetes, I'm not going to control the constipation. Now that's an extreme example, right? Because hopefully we would all recognize that the cat's also diabetic and it's not just in for constipation. But that's true of any of the differentials. If I have a structural blockage, like an adenocarcinoma sitting in my mid-colon, in that cat, I can give it a lot of empirical therapies and directed therapies, but it likely is not going to see a major treatment response until I get that mass out of the way. The second thing is you need to educate owners. So owners have to take a major role in the management of their cat when it's in for constipation. That's because monitoring is so important. If an owner goes 2 days without noticing that their cat's not defecating, by that time, you can create massive injury if that cat keeps eating and keeps filling up its colon. So the owner needs to start taking on the responsibility to monitor very, very closely and understand that with all treatments that we're going to recommend, slight adjustments or missing a day of medications can prove catastrophic for that animal, and they may wind up in your hospital actually obstipated. Then the third category is to actually go ahead and create that comprehensive treatment plan. And the three categories I think of when I'm thinking of my treatment plan is I want to address that animal's water intake. I need to nutritionally figure out what the animal's on and make a dietary recommendation. And then I also likely need to add some sort of medical management to the program as well. So as I go through this, the first thing I'm going to talk about is some of the nutritional factors that I consider. And these are my big four. Okay? So water is first and foremost. It's something we often overlook, but a very important part of managing our feline patients, right? Dogs, if anything, tend to drink excess water unless they have a disease state that causes them not to be able to. So this is definitely very cat-centric in terms of a problem. One, you want to make sure you're maintaining that cat's hydration status. In a mild sense, we want to just screen for disease and make sure there's nothing there. But in some instances, these cats might need subcutaneous fluids or other therapies to do that for them. We also want to look at how we deliver the water to that animal. Okay? So clean water, available water, moving water, and flavored water are all great tactics to increase that water consumption. Okay? So there was a pretty interesting study done by a nutrition group looking at variables like canned versus dry food, variables like how often the water's changed, variables like whether the water's moving with a pet fountain versus sitting stagnant in a bowl. And what's interesting about that is there's no set trend for what makes every cat drink more water. But interestingly, there is usually an individual preference. So all cats don't necessarily love moving water, but your specific patient might, okay? And the owner needs to look around and say, what intrigues this cat? What makes this cat want to drink more often? And I have owners do things from multiple water bowls that are changed 4 or 5 times a day for fresh water to actually pet fountains. And some owners actually leave their faucet on, just dripping, and their cat regularly drinks out of that. Play around with options to get that water intake up. Another good trick is bouillon cubes, the little broth cubes that you can dissolve in their water, and oftentimes that will increase their intake as well. The next thing is fiber. Okay, so fiber for a constipated cat is the main thing that I'm interested in. And why I want fiber is for 3 reasons. I want to increase fecal water content. I want to increase fecal and colonic motility, and thereby increasing transit time. Okay? So how does fiber do that? Well, that goes back to some of our basics of fiber in and of itself. So when we talk about a dietary fiber source that's put into food, there's a couple ways to classify it. One would be solubility, which is my preferred way of thinking about it, at least my preferred way of thinking about it for constipation cases. And the other way is fermentability. Okay? And these are inherently kind of tied together, as we'll discuss about in a minute. But when you start talking about fiber, you can think of a fiber as insoluble, or you can think of a fiber as soluble. And what we look for in an insoluble fiber, or what we expect to happen with an insoluble fiber, is it bulks the stool. And as you remember back from vet school, when you bulk feces and cause expansion against the gastrointestinal tract, that stimulates propulsive waves in the gastrointestinal tract. Right? So by bulking the stool, I'm stimulating the cat's gastrointestinal tract to contract more and push that food downstream. The other nice thing about insoluble fiber is it actually pulls water into the feces. So when we talk about the colon, its main job is to extract water from the feces, which can be a detriment in these cases. So with insoluble fiber, if I increase that, I'll actually pull that water somewhat back into my fecal ball. Soluble fiber, I'm not criticizing soluble fiber at all, but for constipation, it's more of a secondary concern for me. And that's because soluble fiber typically is also more fermentable, and it's what produces the short-chain fatty acids and some of the other metabolomic factors that end up improving gastrointestinal tract health. So having soluble fiber is really beneficial for the gut itself, but it doesn't do anything specifically for constipation. Okay. So when I actually look at what type of fiber source I want, I usually want a mixed or an insoluble fiber source. Okay? So if I'm on this spectrum of insoluble to soluble, I want to be somewhere in between as a mixed fiber, and if I have to toe one way or another, I'm going to toe towards insoluble fiber. Okay? So, looking at that in a bit of a diagram here is a different way to approach fiber in general. So with fiber, up here you have solubility versus fermentability. Okay? And with this, these are just the different types of fiber that are put into pet foods to give the animal the fiber source that they need. Okay? So if you look right here, we've got psyllium, which is a frequent dietary fiber that can be added or put into foods. It's similar to what's in Royal Canin's fiber balance. And basically that falls nicely in the mixed fiber category, a really good fiber type for constipation. Okay? It's going to pull that water into the feces, it's going to promote motility, and it's going to bulk the stools. Okay? Another thing that you want to look at besides the ingredient list, which is all of this up here, is what your fiber estimation is in any product you're looking at. Okay? So you've got insoluble versus soluble fiber, right? And you've also got crude fiber. So most pet food companies are just going to give you the crude fiber associated with that diet. And with crude fiber, the problem is really all it tells you about is a little bit of the insoluble fiber fraction. It tells you nothing about the soluble fiber. So you want something like what's in the Royal Canin product guides that actually shows you soluble versus insolubles or total dietary fiber to actually make a better estimate of what's happening here. Okay. Now, my love affair with fiber has to end at some point. And that's when I have a cat that actually has end-stage colonic disease, or megacolon. Okay? So megacolon is the complication from that chronic distension, where basically the cat's colon has become so dilated that it has no propulsive waves anymore. When you get to that stage, fiber is the cat's worst enemy, because I do not want to bulk a colon that cannot do anything with the bulked feces, okay? So looking at that, if I have a cat that has severe disease, fiber becomes less important and is actually contraindicated in these patients. And I want to switch my dietary goals over to a low fiber and easily digestible diet, similar to like GI high energy. Okay. So moving on from there, other things that can be really useful are digestibility and calorie content. Okay? So if I have a cat come into me that's constipated, I basically want to decrease the amount of excess feces that are getting to the gastrointestinal tract, getting to the colon portion of the gastrointestinal tract. And that's where I can manipulate digestibility and caloric density to my benefit. Okay? If the cat's having trouble processing that amount of stool, I want to preferentially decrease the volume of stool, make it low residue, by maximizing digestibility and maximizing caloric density. It'll allow me to feed less and produce less stool by doing that. Okay? So those are the four main things that I want to be thinking about when I make a dietary plan. The opposite side is my medical management side. Okay? So what drugs do I need to think of to complement what's going on with my dietary therapy and water-based counseling? So what we really call our mainstay of these treatments are my laxatives. Okay? And these are the four, at least for me, these are the four ways I like to think of laxatives. Emollient laxatives are decent in cats, and DSS is actually my preference for an emollient laxative in cats. The problem with these are it's actually best administered as a suppository, and as a result, it's not actually useful in a everyday sense for most cat patients. Now you can get oral versions of this, but there's greater complications associated with those. So for emollient laxatives, DSS can be really helpful. I don't really use the other ones at all. Second, and probably the most useful class of laxatives for us, are hyperosmolar laxatives. Okay? Things like glycerin, lactulose, and PEG, or polyethylene glycol. Now, if I had to pick from this category, my absolute favorite is polyethylene glycol, with my second being lactulose. Reason why I like polyethylene glycol a little bit more is because it's much easier to administer to a cat. And there's actually an oral powder form of this that you can just mix into their food with great success. If you've given a cat lactulose, you know that you're having to give 1, 2, maybe 3 mils of lactulose, and it's a sweet liquid that cats do not enjoy taking. So the polyethylene glycol can be very, very useful for you. In terms of saline laxatives, even though there are some studies that have looked at these, I stay away from saline laxatives. I do not use them. And that's because they can actually cause a lot of electrolyte shifts. Some are more risky than others, specifically like a sodium phosphate enema can cause a lot of toxicity and can actually kill cats in certain instances. So saline laxatives I avoid using if possible. The last category is the stimulant laxatives. Once again, these are acting by inciting irritation in the gastrointestinal tract, which for cats can actually cause just as many problems as it can cause benefits with constipation. So once again, with this category, I don't use these very often. So overall, my big three are polyethylene glycol is my preference. Lactulose is my backup for at-home management, and if I need something in hospital, I will use DSS as a suppository. The other piece of the medical management side is prokinetics. Okay? So we do know that these prokinetics have a propulsive effect and have a peristaltic effect in the colon of cats. And specifically, the one class of drugs that's been shown to do this is your 5-HT or serotonin receptor stimulants. Okay? The one that's been studied the most is called cisapride, but there's also drugs like procalamide, which are in the same class and available as therapies. You can try other prokinetics, right? Erythromycin, ranitidine, or even metoclopramide, but the actual motility effects in the colon in a cat is very questionable. The only one that's been shown to do this are drugs in this class here. So that's kind of my general overview, and I think what makes it easiest is to start talking about a few cases and how we would actually apply this when that animal comes in to see you. So the first case here is George. George is a 7-year-old male castrated domestic short hair. And he was a pretty run-of-the-mill case. We hadn't seen him for anything super exciting or anything super crazy before this. Really just a cat that came in for his annual wellness exams. He was up to date on vaccinations and really had no past pertinent medical history. But now the owner's complaining of pain and vocalization and straining while defecating. Okay? And ultimately, the owner was concerned that George was now constipated and wanted that evaluated. So when we talked a little bit more about it, there were some risk factors. So the owner did report that these were pretty severe events. George was vocalizing and straining, definitely uncomfortable in the litter box. He was part of a multi-cat household. The owner didn't feel like there was any stress component or social stress. These are cats that had been together for 5+ years. But it did make her monitoring ability of the feces in the litter box difficult, and she couldn't really tell us how long things had been going on. On George's physical exam, he was chubby. He looked adorable, but nonetheless, he had a maxed out body condition score and a normal muscle condition score. And when we palpated his abdomen, he was uncomfortable, and you could feel a colon full of feces. So one thing I always educate owners about, especially when they're talking about having a cat with constipation, is using a fecal scoring system. Okay? So this is the Feline Fecal Scoring System by Royal Canin. It's a 1 through 5 system, and normal's kind of sitting here at a number 4. Our constipation cats are these dried, separated pellets at a 5. A lot of times, owners do not realize that this is technically constipation when the feces is falling apart into small pellets like that. Okay? And ultimately, I would like to manage the cat in a 4 or a 3 range after it's been diagnosed as constipation. But if you give an owner this handout and you provide it to them and you teach them how to score the feces, they can be your eyes and ears for that cat and catch things early before it becomes a problem. Okay. So George is basically a very straightforward, it appears, constipation case. Okay? And I'll even tell you that we did a fairly good workup on George because the owner wanted to be aggressive, and we didn't really have any major abnormalities identified. Was that surprising? No, right? We know based on the physical exam and having some radiographs that this was going to be pretty likely to be idiopathic. So, what did we talk about for George? Well, we went ahead and talked to the owner about whatever we end up feeding, we want to feed a moist version of it, or we want to add water to it. Okay? When the cat is eating, we also want it eating water. We also wanted the owner to do a strategic plan to start to try to behaviorally increase water consumption, offering different flows, offering different types of bowls that the water's in, anything like that, and then monitoring to see, did that make George more excited about drinking? If so, we'll keep it. If not, we'll change and add something else. We're going to want a mixed fiber source in our diet, and we'd ideally like something that's easily digestible, whether we add fiber to that or use something like a combination product. Okay. So this is kind of the feeding plan specific information for George. We have to select a diet. We want it to be complete and balanced. We don't want to use something home cooked or something from an unreputable brand that wouldn't provide optimal nutrition. We need to strategically make a weight loss plan because we know the obesity is going to worsen his clinical signs. Ideally feeding him small meals throughout the day so he does not get hungry and overeat. And then also importantly, because he's in a multi-cat household, feed him separate from the other cats. Okay? We do not want him getting into the other cat's food because that will undo everything we're trying to accomplish with our dietary management. So, looking at the list of diets here, we're going through a few different resources, okay? So what I have here is calories as well as some macronutrient concentrations and at the end fiber concentration. Okay? And this is just a smattering of prescription diets that would be available in the US. And the one I have highlighted here is the GI High Energy by Royal Canin. And what you can see is we know GI High Energy is an easily digestible diet. And looking at its caloric content, overall, it's a fairly calorically rich diet. Okay? So it's meeting two of our expectations already. If I then look at the dietary fiber column, I can also see that the fiber content of this diet is pretty good. Okay? I actually have a reasonable fiber content. So the easily digestible diet by Royal Canin, the high energy diet, is actually a great option to go ahead and start with. Another option, I don't have it on this list, but another option would be their fiber response diet. Okay? What you're trading there is a slightly less digestible diet, but a slightly more optimized fiber balance. What I can't tell you is which one would be the #1 perfect option for George specifically. But those would be the two diets that in this scenario that I would want to use based on those two mechanisms. Okay? In addition to starting that diet and adding water to it, I'm then going to choose my laxative. So like I said, I'm going to start with polyethylene glycol. The formulation of that I actually like is called Miralax, but any polyethylene glycol powder would do. And a 1/4 teaspoon with each meal is my preference for starting dose. Okay? And that's something that you can titrate up to find the optimal fecal consistency based on those scoring charts until you can get that animal to a 3. Okay? And then I can also add in a prokinetic. So if I'm using cisapride and it's a mild case, I might start at 2.5 milligrams per cat. If it's a little more severe case, I might use 5 or even 7.5 milligrams per cat to try to get that colon working to move things along. So that's what I'm going to do in terms of my prescribing. What I'm making recommendations. Water, here's the new food I want you to use, and here's any medications. Now, do I start all of those in every case? No, I don't. In George's case, I started all of those because he was actually vocalizing and quite painful in the litter box, and we could already feel harder forming feces building up in his gastrointestinal tract. So there was a little bit more urgency to getting George's case under control. If you had an owner that came in and just described a #5 fecal score, that's a case that I would start diet and nothing else. Okay? So some slight differences in terms of how aggressive I am. I'm also going to be educating this owner as much as I can. What's the water intake like, the things we talked about before, as well as litter box and environmental management. So for the litter boxes, because social stress is hard to determine in cats, I'm always going to recommend to an owner that they address environmental and litter box stress. Okay? So remember, the rule of thumb for litter boxes is you should have 1 per cat plus 1 extra in your house at minimum. Okay? So if a 5-cat household needs 6 litter boxes, 2-cat household needs at least 3 litter boxes. You also want to make sure your litter boxes are cleaned regularly. I'm as guilty of this as anyone. I have very accepting cats in my house, and I'm not good about cleaning it every single day. But you do need to scoop that litter box every single day and fully clean the litter once a week or so if the animal might have litter box aversions or issues. And then environmental management, we're going to talk a little bit about how stress can be a really important part of feline gastrointestinal disease, specifically constipation. So the more I can manage the environment, right, get into the cat's mind and understand what a cat actually wants in their environment, provide them higher places, quiet places, perches. A lot of cats need interaction, especially from who they're bonded to. Some cats like music, TV, left on for them while their owners are gone, and there are set albums that are proven to be more stress relieving in cats than others. And this is really, really, really important for indoor cats, because indoor cats actually are known to have a higher stress level than outdoor or indoor-outdoor cats. Okay? So we definitely want to be aggressive about these things. We do not want to overlook them. And why I stress this is when I talk about 60+% of cats having an idiopathic reason for constipation, it's not that there's no reason for constipation, it's that we can't find the reason. Okay? And part of our theory on why we can't find that reason is because it's stuff like this. It's environmental stress, it's social stress, it's litter box anxiety that's causing the cat to not want to go rather than a traditional pathophysiologic disease. So just a few notes then on gastrointestinal tract and stress in our cats. So Dr. Tony Buffington's a friend and colleague of mine, and if you're familiar with feline interstitial cystitis, right, that's the sterile inflammatory bladder disease of cats. Over the past 20 years, what his research has done has shown that this is not just a bladder disease. Okay? It's more of a Pandora syndrome or Pandora's box, where nearly every organ in these stressed cats has some degree of dysfunction associated with it. Okay? And the gastrointestinal tract is no different. This was a study of FIC cats displaying sickness behaviors, including some gastrointestinal tract signs. Environmental management alone, decreasing stress, providing a more favorable environment, was able to decrease abnormal signs in 75 to 80% of those stressed cats. Okay? It's a major variable that we need to consider and manage in our feline patients. Unfortunately, stress-mediated dysfunction of any organ is a rule-out, right? So it's a diagnosis of exclusion and a response to managing the animal's environment and stress level, whether that's pharmacologically or otherwise. So that's kind of George, and George responded pretty well to that management, and I actually haven't seen George in a little while, but last update was about probably a year ago, and he was still doing well on those doses and on his GI high energy. So this is a slightly different case. This is Grisabella, and one of my residents actually saw Grisabella. She was a 14-year-old female spayed domestic short hair. Now Grisabella, my resident was seeing for chronic kidney disease, and we had been seeing Grisabella from when she was diagnosed as a stage 2, all the way up to the current time when she was a stage 3. And when Grisabella came in for her recheck, the owner said, you know, I'm noticing that she's defecating less, she's straining a little bit more in the litter box. These are her medications to control phosphorus, and she was already on a Royal Canin renal diet. Okay? Renal support A is what we have in the US, but it's very similar to the renal diet that you have here, just to put it in perspective. So for Grisabella's case, if I go ahead and look at these different diets, here's some different options I have, right? So I could potentially use what she's on right now, which is the renal diet, or I could use a renal can diet, or something that Royal Canin just launched in the US, which is a multifunction diet. And that multifunction diet is a hydrolyzed protein diet that is also formulated for renal disease. And if I look at Grisabella's case, I now have multiple things I need to manage, right? I have a kidney cat that needs renal management, and I also now have a constipation cat that needs highly digestible plus or minus fiber supplementation. So looking at these three, well, this is actually probably my best bet because it's renal supported, but it also is hydrolyzed, making it very easily digestible. Okay? But it's not necessarily what we would think of as our primary diet that we would go to for Grisabella's case. And what I want to stress here is that we need to think outside the box and realize that diets often have overlapping abilities, and we can capitalize on them. Even switching her to a canned variety of the renal diet, though, would still be preferable to utilizing the dry diet, once again because of that water intake factor. Okay? That shouldn't say George up there anymore, but basically on this one, I'm giving you a comparison once again, and you can look at those macronutrients and see that by using a renal diet, using that diet, I can still maintain a renal appropriate phosphorus and protein level while still achieving the caloric density, the fiber content, and other goals that I want associated with that diet. Okay? So this is where having those product guides in your office and being able to flip to them and look at some of those macronutrient concentrations can be really, really beneficial in saying, I'm going to think outside the box and I'm not stuck to just this one diet. A company like Royal Canin has a whole plethora of diets that can be very useful in these scenarios. So the third case here is Fluffy. So Fluffy is a 14-year-old female spayed domestic shorthair with ongoing problems of chronic constipation. So we've already been seeing Fluffy, at least at this visit that I'm about to show you. And Fluffy was on pretty much standard therapy, Miralax and Cisapride, right? So a laxative as well as a stimulant. But the owner wasn't really good about the diet. Okay, and she instead just kind of wanted to keep feeding her maintenance diet that the other cats in the household ate. But we were, because of the owner's wishes, managing Fluffy in that manner. So when Fluffy came to us, this was the radiographs here. So this is the lateral abdomen, and I'm guessing most of you guys can see the abnormality here, right? So we have a lot of feces stretching the entire length of this cat's colon. Okay? And when you palpated this cat, it basically felt like she had a cement cylinder inside of her abdomen. Okay? On the DV view, you can see the same thing extending basically all the way to the blockage right at Fluffy's anus. Okay? So now this is a very different case, right? Because now, if you're seeing a cat that's able to get to this point, what am I concerned about? I'm concerned about megacolon in this cat, right? This cat has functionally lost a lot of its capability in its colon, and now I need to manage it differently. Okay. So because it's so severe, I am going to potentially go back and repeat some of my aggressive workup. If this wasn't the first time I saw Fluffy, I would certainly recommend the aggressive workup to begin with in a case like this. And before I can titrate my medications or do medical management, I need to clear all of that out. Okay? There's no diet in the world that I can feed Fluffy now that's going to evacuate those bowels. Okay? So I'm going to have to add in a few other steps. Okay? So the first thing is evacuation. Now, my preferred way of doing this is non-invasively. So there's two options. For milder cases, I can just use enemas. My preference is warm water at about 5 to 10 mils per kg. You give that to the cat, give it a little time. An hour later, you give another enema, back and forth. I'll often add lactulose or a lubricant, just like sterile lube from what you would use in your clinic, at about a 1 to 10 ratio to that water. Okay? You can also try DSS as a 5 mil suppository dose, but just keep in mind all of this stuff is probably not going to be okay for Fluffy. Okay? That's going to be okay for the animal that just has a mild case of constipation that you want to clear out. For Fluffy, if I do this stuff, it's actually probably just going to cause more discomfort for Fluffy. Right? Because there's no way that cat's going to be able to pass that just with an enema or two. So an alternative approach is what I'm showing here in these pictures, which is to place a nasoesophageal tube. Okay? So placement of the nasoesophageal tube, we go ahead and sew it in place, and we leave them in ICU after confirming placement. Then we use an oral polyethylene glycol solution through that NG tube overnight. Okay? I put 4 to 8 hours because that's what's documented in the literature, but usually I put them in at the end of the day and I leave them on this until the following morning. So most of the time in my clinic, they're actually on probably closer to the 18-hour mark. And what I'm going to do is about 6 to 10 mils per kg is going to go through that NG tube of that polyethylene glycol formulation. So this is very, very similar to a colonic prep for a colonoscopy. Okay? And what you can see is in obstipated cats, within 6 to 12 hours, a large amount of them will defecate. Okay? The only caution is you really want to make sure you've ruled out obstructions, because it's unfair to do this to the animal if it can't actually defecate because there's a blockage. Okay? But that's a really good option for a lot of cats in hospital. Now, if that doesn't work, what you're going to have to do is actually manually deobstipate them, which is neither fun nor glamorous, right? So this is where you're actually using a similar enema technique and then manually extracting the feces. Now, why this is a secondary choice is because when I'm compressing a colon full of feces, I'm actually traumatizing the colon. Okay? It's not colon friendly. So if I have the option, I'm going to avoid doing it at all possible, and that's why I'd try the NE tube approach first. But with this technique, basically you need the cat under anesthesia, and you'll use your index finger in one hand to assist the feces from exiting the rectum, and then you'll use your other hand to actually milk the feces down the colon and apply constant pressure to move them out. All of this should be done with liberal lubrication and water to liquefy things as much as possible. Okay? So you remembered Fluffy's radiographs beforehand. We did go ahead and try the NE tube, and Fluffy was not tolerating it and pulled the NE tube out. So the next morning we decided to just go ahead and anesthetize Fluffy and go ahead and do a manual deobstipation. And in this case, these were our post-deobstipation radiographs. Okay? So what you can see here is there's a lot of gas bubbles in the intestinal tract. That's pretty typical after a deobstipation because you're getting a lot of air that goes up into the gastrointestinal tract. But we've now been able to clear the entire bowels out. Okay? I have a fresh canvas, if you will, to start managing Fluffy's case once again with medical management. So what am I going to do? Well, on all of those doses that I used for the cisapride or the polyethylene glycol, I had room to move up. So I'm going to dose escalate the medical management that I am using in this case. I'm also going to review medical management at home, right? It's well known both in human medicine as well as in veterinary medicine. Owners do and listen to only a fraction of what we tell them to do, right? Reiterate, reiterate, reiterate. emphasize that stuff so that they really understand the importance. And then the major thing for Fluffy is I now do not want fiber in Fluffy's diet, okay? So based on what Fluffy was on before, I could actually even just switch to GI high energy canned, right? And what you have here is I can really drop that fiber content down drastically with the canned version, okay? So once again, making a small adjustment that then decreases the fiber content while still providing me that low residue, easily digestible diet. Okay? So in the end, what we're trying to avoid is this. Okay? So this is a cat's colon that was taken out at a subtotal colectomy after failure of medical management for too long. Okay? This is a massive surgery for those of you that have referred for these cases, and there's lots of complications that can be associated with it. So anything we can do to prevent this and avoid that would be advisable. Okay? So the last thing I want to leave you with is just two more things about what happens to the cat's gut as it ages and why constipation as well can be a big issue. Although we have a massive reserve function in the gastrointestinal tract, we do have a lot of physiologic and functional changes that occur as that cat ages. And ultimately, the two studies that I think are most interesting, and we kind of referenced these in the last Q&A session, is that transit time and motility are decreased in geriatric cats, and reduced digestibility is common in geriatric cats. And because of that, you are setting up a perfect storm. So I have a geriatric cat with reduced digestibility and poor colonic motility that then I dehydrate slightly because it became hyperthyroid and developed CKD. And all of a sudden I have 4 factors that are really pushing dehydration. In those cases, if you can talk to the owners and identify subclinical constipation before it gets bad, you will be much better off in the long run, and you can manage them much more adequately. So with that, we can open it back up to a few more questions. My contact information's up here, so if you guys have questions, feel free to message me or email me, and I'm happy to take those.
好，现在是提问环节啊，很高兴我们今天大家听到了最后。那么对于这个便秘的问题啊，我们是不是都已经知道老师讲的什么粮食啦？有什么粮啊？是不是有肠道粮啊？是不是还有高纤粮啊？那么对于这个所有的知识呢，刚才我们提到过，都可以从我们的精英会这个学习平台上走进去。 然后看讲座，还有其他讲师的讲座啊，看完之后学习完了提问，都是一整套的流程。那么这个病例竞赛啊，要提一句的就是，是我们皇家专门给大家带来的一个福利吧。只要大家能提供完整的一个病例信息，我们都会给大家一本书啊。上半场会说，那么其余的呢，通过最后一个终审，就是北京会的一个评比，我们会送大家到法国。 去学习临床的这些知识，好。那么现在呢，我们来提一些问题吧。有没有问题要跟老师讨论的？好。谁举手来的？
我们都知道那个猫的冠状病毒，然后猫肠道的冠状病毒引发的那个 FIP。 它在治疗一段时间之后，那个冠状病毒的检测板会变成阴性，然后这个情况下是怎么样去解释这个问题？
So is the question, are you seeing constipation in your coronavirus and FIP cases? Okay, so with feline infectious peritonitis, coronavirus is actually quite ubiquitous in the cat population, right? So coronavirus in and of itself, in most instances, is not much of a problem. When you have a cat that develops FIP, one of two things can happen to the gastrointestinal tract. And if you come up after, I can show you some pictures of gastrointestinal tracts from cats that had severe infiltrative FIP. The first thing is that you can get just the typical vasculitis lesion associated with FIP. Right? So when FIP develops, you're getting an immune-mediated vasculitis that also ultimately will affect function of the gastrointestinal tract. And you do have decreased GI transit in FIP cats. Okay? So some mild constipation can occur secondary to that. In severe FIP cats, you can also actually get granulomatous lesions to the point where they actually have nodules and masses that actually has been documented to cause obstruction. Those would be the two main reasons why I could see an FIP cat becoming constipated. Therapeutically, you would treat that cat exactly the same as you would a cat of a constipation of any other cause, like an idiopathic. That's because we have nothing specific we can treat FIP with. The one thing that I would potentially try is corticosteroids. Okay? And the reason for that is there's some evidence to say that decreasing that immune-mediated vasculitis might then improve the function, at least in Annette Litzer's experimental models.
好的，我们还有5分钟结束啊，大家耐心的去听完。最后的我们也是给老师一种尊敬啊，老师也讲了一天了，大家也都很累，我们很理解啊。那抓紧这个时间，还有谁有问题？
我想问一下，那如果碰到那个猫的巨结肠的话，就是先排便，然后就通过饮食调理就好了，没有说手术的方案是吧？我记得好像，就手术的方案是不可行的，是吧？
So surgery for megacolon cats, I consider to be a last resort. Okay? So what I generally tell owners are, let's say you're managing the cat, and then all of a sudden, like Fluffy's case, it comes in, and you're like, all right, this is now a megacolon. Okay? I'm going to try 1 to 2 times to manually or medically deobstipate the cat and optimize treatment. What I want to know before I send the cat to surgery is that I have optimized treatment, okay? So ideal treatment. In Fluffy's case, they weren't on diet, right? So I had something I can change. When I switch over and recommend subtotal colectomy for megacolon, it's when I have nothing left to do medically. Okay? So it's not something that you should be avoiding in your patients, but it's definitely less preferable to medical management. So as long as you have something else that you can do medically for the cat, that would be my preference before going to the subtotal colectomy.
还有问题吗？
你好，老师。我们这边有一只小猫咪的话，它的名字叫喵喵，然后今年16岁了。然后它绝过羽是一只公猫，它以前有患 DIC， 然后手术有把它切除它的最后一段结肠。然后现在的话，就是因为一直在我们医院在做一个维持，它会出现便秘的情况。它每天的话，我们是强迫给它饮水10毫升，4个小时一次。然后如果糖1天2次，2.5毫升，还要再加上西沙比利，也是1天2次。 以前有吃过那个希尔斯的那个肠道处方粮，但是并没有得到一个很好的控制。现在给它换成皇家的高纤维的易消化粮，慢慢的有在做一个调整的情况下，还是会偶尔出现一些便秘的情况。就是这样的话，主人其实放在我们医院已经住院有3年了，就没有办法带回家。这种有没有什么特别好的办法，就是给它做一个调节，让主人给它就是能够带回家饲养？
Yeah, so the first thing I would try is, although the fiber response is a great diet, if this cat, if I'm understanding correctly, has already had a subtotal colectomy and is now constipated again, and in that instance, I want to get rid of the fiber, okay? So I want as low residue diet as possible. So what I would switch to is the GI high energy canned form for this cat. Okay, so basically I want as little fecal matter entering this cat's colon as possible. You also will need to reevaluate to see whether you've got distension of the gastrointestinal tract again. So even though you've taken out a large portion of the colon with a subtotal colectomy, chronic distension can actually not really grow back, but you stretch the colon again, and you can actually cause more of a reservoir function a second time. So some cats will need revision subtotal colectomies if that's the case. Okay? But so if you've already maxed out cisapride and you're at like 7.5, maybe even 10 milligrams per cat, BID to TID, and you have your polyethylene glycol really going into the cat strongly as well, and then you cut it back to the canned Royal Canin GI high energy, that's when I would then say, all right, maybe we just need to look at looking at adding back in the reevaluating, the colon for whether I've got a dilation effect. There's also a more radical surgery that basically takes almost all of the colon out completely, and you do like an ileorectal anastomosis. Now, that cat will be able to go home, but that cat will probably leak feces for the rest of its life. So that's something that you have to have a very, very dedicated owner who's very, very aware of what type of life that cat's going to have after something like that. Some owners don't mind it, but the cat's likely to be incontinent after something like that. Okay?
好，还有谁有问题？来举手示意我。我们说问题的时候声音稍微大一点。
你好，老师，我就想问一下，就是您刚才举的那个第3个病例，那个猫咪那个便秘已经很严重了，在这种情况下，它主人肯定应该在之前没有特别注意它的情况，才导致这个病情发展严重。但发展这个严重的时候，我觉得应该会有呕吐或其他的临床症状，才带来医院去看诊的。那这种情况的话，您要下完鼻饲管的话，再给它吃那个聚乙二醇，可能会不会也引起呕吐？这是第一方面的问题。然后，如果第一个方案能让它把那个便便通了，那肯定是最好的。如果说这个粪便通不了，那个在体况，如果年纪比较大、体况比较差的话，这样的灌肠会不会给它出现一些更严重的应激，会造成生命危险？然后再有就是，如果说这一次性灌完的话，可能会不会产生更严重的其他的问题？这个便可以分1到2次分别的给它灌完吗？是这样的问题，谢谢。
Okay, so let me know if I don't answer all of the questions, and I'm happy to come back in case I miss something. In terms of Fluffy's case, I completely agree with you. We missed a lot of things, right, due to owner compliance and other stuff moving up. And that's why I can't stress enough with constipation in cats, catching things early. And if that owner had been monitoring like bowel movement frequency and stool consistency, we never would have hopefully gotten to the point of actually being obstipated. The second issue is the vomiting that we'll sometimes see with constipation cats. That is a variable response due to the gastrocolic reflex arc. Okay? So that is a natural reflex that works both directions, right? So if you eat something that doesn't agree with your system, that is the protective reflex to immediately evacuate your bowels, and within minutes you can have a peristaltic rush and a very liquidy large bowel diarrhea. Same thing occurs with colonic distension. It can tell your stomach, hey, we can't take anything else at this point, and you actually get vomiting in relation to that colonic distension. Why we don't always see that in cases like Fluffy is that neurologically we know we're damaging the gastrointestinal tract and we're probably affecting some of those reflex arcs. So the vomiting associated with colonic distension appears to be variable. Some cats will have it, some won't. In terms of actually using the nasoesophageal tube protocol with the polyethylene glycol solution, only one study has actually looked at that in an organized fashion. Vomiting was not an issue in that study, but that's just one study and it wasn't giant numbers, okay? The other thing I can offer is in my own personal experience, I don't think I have any more problems with cats that I'm putting in nasoesophageal tubes for constipation than I do for nasoesophageal tubes for other reasons. Part of that is I'm giving that polyethylene glycol solution as a CRI over a long period of time. If I tried to give it as a bolus, I think I would have a lot more complications. But giving it at the 6 to 10 mils per kg per hour is pretty manageable for most cats because you're talking about a lower volume. Oh, and the last thing, the enemas. If you get a cat to that point, in general, a couple enemas is not going to do it. You need something else to really move things along. So a couple enemas under anesthesia, yes, that would be appropriate, but you're really just deobstipating the cat at that time. But a couple enemas in an awake cat, you're not going to be able to make an appreciable difference.
好的，因为时间关系啊，我们最后一个问题，大家抓住机会，有提问的吗？比手速啊，有提问的吗？好。
我想问一下，就是比如说腹泻的小猫，然后它已经脱肛了，然后那个肛门就是结肠已经变黑、肿大，甚至溃疡，已经流脓了。 那这种情况是有必要进行核包缝合吗？或者说用一些皮质类固醇冲洗肛门，或者说结肠切除这样，应该怎么处理？
So you're asking about cats with colonic inflammation that are being constipated or having diarrhea? Okay. So in general, if you have inflammation, regardless of clinical signs, yes, corticosteroids can be helpful. Okay, so the short answer is that would be a reasonable approach. Most of the time, an inflammatory constipation tends to look a little bit different. So if you have any sort of inflammation and diarrhea, definitely utilize a lot of those principles, including immunomodulators, to get that under control, and that'll overall help. In the context of constipation, inflammation typically causes an outer diarrhea. So those cats will actually come in and the owner will report they're having diarrhea even though they are constipated. And what happens is around the constipated material, that inflammation basically creates a lot of discharge and mucus, and then the cat will defecate out just like kind of looking like large bowel diarrhea, but it's really just the inflammatory debris around the constipated feces. You need your abdominal palpation and your imaging to differentiate those.
好的，因为时间的关系，我们现在把掌声送给 Adam 老师，谢谢他讲解。Thank you, thank you so much. 好，我们今天的课程就到这儿。明天8点半呢 ，Adam 老师会继续跟大家分享慢性呕吐的一些病例。因为要换同传设备啊，我建议大家缓慢的按照我们工作人员的指示退出去，要不然它混。